I'm so honored to be a fellow for AAFPRS, which is the American Association of Facial, Plastic, and Reconstructive Surgeons. It's not an easy organization to join, and I'm very honored that they have accepted me in, and I'm even more honored that they have invited me to come and speak at their big national meeting, which is out in Las Vegas on September 23rd, 24th, and 25th. I've been asked to speak on the art of the consultation and pearls for facial rejuvenation. And really what this is going to allow me to do is share with other surgeons who are doing facelift surgery what it is that I find most important to be able to share with patients. When they come in, they're very nervous, they're very insecure, they've done a lot of research on social media and on the internet, and sometimes they can go down some really dark holes and come with some very interesting questions that really I would never have thought of. But you need to be able to convey very simply and clearly to a patient what it is that you can do, how are you going to address the concerns of ensuring safe surgery, minimizing any chances of infections, avoiding any bleeding complications. Many times we're talking about addressing the glands in the neck. Honestly, this is one of the highest topics and most talked about at these meetings is the issues of gland resection and partial shaving of a little bit of that gland so that you can get a really strong, clean jawline. And the reason it's an issue is because it is a very vascular piece of tissue that is deep down in the neck, up underneath the platysma muscle, and it requires very specific retraction help, and it requires very specific anatomic surgical dissection, and you need to be able to address any kind of bleeding that starts while you're doing this part of the operation. So when you're talking about the pearls, these are things that are going to come up while you're talking with a patient and they're asking, how are you going to address my neckline? How are you going to give me a really sharp neckline? In the past, the whole concept was to educate at the third grade level or a very simple level. That is not true today at all. Our patients are coming in with PhD level education for what it is that they're hoping to achieve. So they're coming in with very high level questions. They use terms like deep plane facelift. They use terms like SMAS plication. They use terms like sialocele, which could be a leak of the fluid from the gland after you've done a partial resection. They understand a lot of these very high level, nuanced portions of this operation and the subsequent recovery. It is a fantastic opportunity, having published in this area, that I can just turn them and say, here's my paper that I published in the Aesthetic Surgery Journal. Let me show you how to access it. And then they have it right on their phone. And it's a phenomenal way for them to have a tremendous comfort level with what it is that we're going to be doing. They can see results that I have published internationally, as well as they can read through some of the steps of the operation, because honestly, these patients are coming in this well prepared. The deep plane operation where you're lifting up the SMAS, that superficial muscular aponeurotic system, and why that is such a huge innovation in the last 10 years. So excited to be participating in AAFPRS. It's wonderful that they've invited me, and I'm very honored to be a fellow of their society. It's going to be so wonderful for me to be with so many of my friends and colleagues at this meeting, sharing ideas about different talks and different areas of interest, and being able to share my thoughts with all of my colleagues out there about the art of the consultation and the pearls for excellent facelift results. Hope to see you there.